about that. So my name's Julia Smith. Many of you know me already. I'm a naturopathic medicine practitioner here, herbalist and naturopath, and I work a lot with brain health and Alzheimer's and dementia specifically. So I'll let the panel introduce themselves again. We'll start with you, Hazel.
Hi, I'm Dr. Hazel Batten. I'm the Integrative GP here. I love anything to do with women's health or anything complicated, really.
Wow.
Well, not anything, but I see a lot of endometriosis, PCOS, perimenopause, menopause, and I try and manage it in a conventional way, but also looking at the natural side of things too and trying to combine them.
I'm Caroline Wallace. I'm a naturopath here at Remede as well. So my passion is women's health or men's health as well, but I sort of specialise in a lot of hormones, fertility, but also in cancer as well.
My name's Adam. I'm the acupuncturist here. I also do Chinese medicine, and I specialise in men and female health from the Chinese medicine perspective.
And if I can add, we're very, very happy to have you here, Adam. So please.
Thank you. Please don't attack me. I come in peace.
Hi, I'm Jane Mangini. I'm a clinical nutritionist and sports nutritionist. And I love women's health, and I love working with women, but I'm all about the food and the lifestyle because it changes. And, you know, I hear a lot of, sorry, I got the Invisalign back in, so I'm lisping. It's so embarrassing, sorry. You know, it's because life changes and we're left like, oh God, I'm doing what I used to do and nothing's working, and I love that. So let me add it.
The challenge.
Yeah.
The challenge. So I've got a few questions to get us started, if that's okay, just to get us warmed up. I know a lot of the questions in the room will be around hormone therapy and how that works and is it right for me. Obviously this isn't a personal consultation, but we'll save those just for a moment for Hazel, if that's all right. I wondered if we might just get a bit of a conversation around, are the natural therapies the first line? Are the natural therapies the solution for some people, not the solution for some people? What do we think in terms of natural options and the pharmaceutical options and how they might sit together? Anyone?
It really depends on the patient and what their preference is. People that come to me and maybe prefer more natural options are the ones that are really like going on the old data and just very scared of hormones, and like they mentioned in the movie, and they just, you know, don't want to touch them with a barge pole, but then you can try and educate them, and sometimes they come round. But yeah, I think it's nice to have both. Hormones aren't 100% the answer to everything, and you do need other sleep support maybe, or if they're doing exercise, other nutrient support, and yeah, I think a mixture is nice, but it really does depend on them.
Yeah, I would agree. Adam, can I specifically ask you what you would do with acupuncture? How would you use the needles?
While it is a standalone independent treatment, it works well as an ancillary treatment. So working more with the parasympathetic nervous system and its relationship with the acupuncture alone, how it affects the hypothalamic, pituitary, adrenal axis, and how it releases the hormones there. It's working with the central nervous system and the endocrine system. It just helps to level and balance out the hormones and helps with some of those the vasomotor symptoms like the hot flushes, the night sweats. Just help to downregulate some of the symptoms that people struggle with.
Great. So although it might not be a specific solution to resolve menopause, it's going to support a lot of the symptoms that people, and the things that really do cause problems.
Yeah.
Hot flushes can be really quite, challenging for a lot of people.
Yeah, well, that tends to be the main symptom that people suffer from is the hot flushes, among many.
The joint aches and pains and things usually.
Yeah, so acupuncture is probably well known for its being the wheelhouse of musculoskeletal injuries, but it does a lot more than that. Like just the hormonal response from just having the needles in your body creates its own independent response.
Can I ask, Caroline, this is probably your space, because I know this is an area that a couple of people asked me questions about already. So you treat a lot of people who have experienced cancer or are going through cancer treatment, or maybe have cancer in their family and just have the risk factors there.
Yeah.
Where do you work with people? Is it do they already use the hormone replacement therapy, or is it more the natural? Where do you bring
with those, well, that's always a question that if they're being treated for a hormonally driven cancer, then it's like, okay, well, that's not an option. So what else can we do to support you through those symptoms? And then obviously you've got women who come in and they've been through treatment and they've gone into menopause, whether it's early and it's started all those symptoms again. So it's looking at ways of supporting them without needing to have replacement therapy because they can't do it. And then you've got others that come in and say, okay, well, I've got cancer in the family. How really individual, how close is that relationship? Is it like your mother? Is it your sister? Mood sort of okay, well, and then looking at their risk factors. So we actually, there's testing we can do to see, genetic testing, to see what their tendencies are towards if they've got specific genes and they have a history, a family history, so okay, maybe that's not suitable for you, let's have a look at something else, or you just have to manage them really carefully rather than saying it's all okay, it's all fine, or it's 100% no. So it's individual, looking at that person, looking at the history, looking at what comes back in testing as well. And there's lots we can do, but there's always another way. There's not just one, which is what we're really lucky to have.
Really lucky to have this combination of expertise around as well.
Absolutely.
Yeah. What sort of testing are we doing for hormones?
The most basic testing would be just a blood test. I usually do a day 2. Well, if they're still having periods, usually tests on day 2 or 3 because you can gauge what the FSH and LH are doing, the pituitary hormones, and if they're going above a certain level, you might be thinking, oh, this is perimenopause, and obviously you go on symptoms. And then if they're having a normal cycle, you normally do it 7 days post-ovulation and maybe see what the progesterone is doing in the second half of the cycle, because usually progesterone is the first hormone to dip in perimenopause, and that's why we can start getting more PMSy symptoms and heavy periods, painful periods, which often happens in our late 30s, 40s, and just boosting progesterone by herbal methods or by using natural progesterone can be really effective. Like they talked about testosterone. Testosterone is not like we go through perimenopause and menopause, testosterone plummets. Like testosterone, 50% of it is our adrenals, 50% is our ovaries, and our ovaries can keep on making it for the rest of our lives until our ovaries start to get a bit smaller with age. So that's a more linear thing. But if we're in a phase of life where we're ridiculously busy, we've got kids, we're working, our testosterone is probably likely to be low because we're under all that extra stress, so that can be another useful hormone that we might introduce early as well. So, did I answer your question?
No, it does.
Testing. And so then,
there's more.
So then, blood tests are the first line, and then we can do, we can do more informative testing. So another test that Caroline and I and Julia would be a Dutch hormone test sometimes, which is the dried urine testing, which isn't normally done by most conventional doctors. Usually I do this mostly when I've initiated hormones, because sometimes in the perimenopause period the hormones can be very unstable, and just in terms of timing it can be difficult to get it on the right day. Usually you do it at day 21, but post-menopausally, if you're using HRT, it can really tell you how your body's processing the hormones. If you're worried about the effects of estrogen, you can see how estrogen is being metabolized in the liver and how your body's removing it. So it can be a really nice test if you've got any of those fears around hormones.
It's a really informative test, isn't it?
Gives you really good clues as to how your estrogen is getting sent out of your body, because if it's getting recirculated around and going down the wrong pathways, you don't want that to be going. Don't be taking hormone therapy if you are everything's going out the wrong way. So you want to make sure first that everything's moving the right direction and that it's going to be successful and not turn into the wrong therapy for you.
But it's not just something that, we've had these genes, so mainly this happens because of genetic SNPs sometimes, amongst other things, but we've had these genes for most of our life, so it would have been doing the same with our own hormones. It's not like just because we're taking HRT, things are going to go wrong. Like,
No.
we've had hormones for our whole life. So yeah, you can look at these things much earlier on if you wanted to.
Yeah. Thank you. The next thing I have on my little list here is they talked quite a lot about lifestyle change and diet and exercise, and I wondered maybe, Jane, if you could sort of bring a bit of that in for us.
Yeah.
They mentioned there that heart disease is the leading cause of death in the US, and I know in Australia it's definitely top 3. I'm not sure where it currently sits. But what would you think of sort of lifestyle medicine that we can all do, whether we're on HRT or taking hormones, taking herbs or having acupuncture? What else?
Oh, so
would we
much
go?
things I want to talk about, but I don't know if we've got time. But yes, so I see a lot of, well, in my age group, a lot of my friends or colleagues or clients that come and see me, and they'll say, I'm doing everything that I used to, I can't lose weight, or I can't, and I do the thorough, you know, okay, tell me about your day. How is your day? Who are you looking after? Oh, we've got small kids still, quite often, or kids that need a lot of attention, or we've got ageing parents, and we're still working, and then we're trying to juggle all that, and maybe we're doing a renovation, or maybe we're, you know, planning something else, and then I'll say, talk to me about your sleep, and they're like, what a joke. So I look at that, and then I ask them questions around, you know, you're flicking on the screen, how many wines are you having? And then they'll talk about their weight, and I'll be, but I'm just getting the same as I used to, or I've cut back, I don't eat until 1 o'clock, and then I go, and then I don't mean to be rude, but I go, well, how's that working for you? And then they're like, obviously it's not. So, you know, what are you eating at 3 o'clock? Yeah, I want the chocolate, the muffin. I sit on the couch and I can't stop eating. I literally can't stop, Jane, you don't understand. I do understand. So, you know, I have a dig around, you know, is fasting working for you? And quite often perimenopause and menopausal women, because of our stress levels, our lifestyle and our cortisol, fasting doesn't work. But you know what, let's maybe stop eating at 7:30 at night on the couch.
Yeah.
That could be our fast until the next morning. But I'm obsessed with muscle.
Great.
I'm obsessed with weight training for everyone, I don't care, because muscle is our anti-aging organ, and it's going to keep us upright, it's going to keep us, sorry to be vulgar, wiping our own bottom at 80. Yeah, it's going to keep us out of the nursing home. And so we are losing muscle as we sit here. So, you know, for the people like, oh, I don't want to get bulky, it's not going to happen. You know, 2 kilos of muscle is that big, whereas 2 kilos of fat is that big. So, you know what, I give people a darn good talking to about that.
And about the relationship there with testosterone as well.
Yeah.
So naturally raising your testosterone
Yeah.
through pumping some iron.
Exactly.
As I found recently coming out of the gym, using a young man.
And
Well,
it reduces
yes.
well, usually reduces stress.
Yeah.
Well, he deserved it, Hazel.
No.
He definitely deserved it.
And just around, you know, the foods that we used to eat that worked for us when we were on the go, and we could grab a coffee on the way to work and not eat until 11 and have a couple of coffees, and then, you know, sort of have a muffin or a toasted focaccia, and then, you know, then we're heading with, you know, look, I'm sorry, I don't mean to, you know, and then a bowl of pasta and then some ice cream, and I'm like, or a music, oh, have a good snack, have a healthy music bar, I'm like, oh, let's wind that all back. Those things don't serve us as we age and we go through menopause. Even the Australian dietary guidelines, which I don't follow because it's, anyway, that's just a political thing, but the Australian dietary guidelines say that women can have up until 50 years old, 6 serves of grains a day they recommend. And then all of a sudden at 50 it drops down to 4. I mean, and that is the Australian dietary guidelines, which is a lot of hogwash, but even that indicates back off the toast, ladies. Just back down off the toast, because it's doing you no favours. And so I put people on, and I'm not all about carnivore diet either, but put people on some protein early in the morning, a good lunch, lots of plants, healthy dinner, back off on the grog, you're going to sleep a lot better, lift some weights, and people are like, my pants got looser, and I'm like, no, Sherlock.
Yeah.
It happens like that. So yeah, food is, you know, paramount in just lifestyle, paramount, food, sleep, exercise, and all of those things can have a massive impact on people's symptoms and how they're suffering, you know. And I love this saying, my mum said it to me, and she's so right. It's like women can do anything and everything, but not all at once.
Yes.
And when we hit 50, you can't do it all at once.
Yeah.
So yeah,
Yeah.
And even in
that's my
terms
TED
of-
talk for the day.
But even in terms of the toast and the carbs and the spikes in blood sugar that
And
we
insulin
get,
resistance.
and then the hot flushes throughout the night. So your favourite protein just keeps the blood sugar nice and
Sure.
stable.
Yeah. And that awesome doctor, Mary, yeah, she is all about, have a glass of wine, but don't sleep. You choose a wine or you choose your sleep. And I'm like, I am at that stage now myself. So I'm like, how much are you drinking, or how important is alcohol to you?
And I think you make a really good point that might have been lifestyle and diet in the past, but it simply just doesn't
Doesn't
serve
work
us
anymore. Yeah.
Yeah.